Hi, my name is Paula and I work at Eastwood Clinic in Paris. My job title is LPN and I'm also nursing supervisor at Eastwood Clinic. I have been a nurse since 2007 and have worked at Eastwood Clinic since 2013. I obtained my education at the Technology Center in Paris and took my state boards in Nashville, Tennessee. An average day at Eastwood Clinic, I get in a little early and go through the documents that came in the night before. If anything, Dr. McGee needs to be reviewed, I send it to him, label and close it. We have refill requests that come through from the pharmacies. I make sure those are labeled and sent to Dr. McGee properly. I make sure all my rooms are stocked and ready to go before patients start coming in. When a patient comes in, I bring them back, obtain their vital signs, make sure the information is up to date, such as their allergies, their medication list, their pharmacies. We go over their reason for their visit and any documentation that Dr. McGee needs to have in front of him to complete this visit. I ensure he has that documentation with him. We do receive phone calls during the day. They are called patient cases. Every one of those are addressed. They come from the patient, caregiver, home health. They could come from an outside provider or a pharmacy. And we have to ensure you have the proper documentation to ensure that if anyone goes in that, to read it, to make sure it was completed, that they can understand the message itself. What I love most about my job are my patients and their families. Getting to know them and their family members is the best part of my job. The hardest part of my job is losing a patient. Communication is one of the traits I use every day, many times a day, because I'm having to communicate with my provider, I'm having to communicate with pharmacies, and I'm having to communicate with that patient so they know when they leave that office that day, any new meds, instructions, they understand and have no questions. Teamwork is another one that we use, one of the traits, because everybody has to work as a team. We can't do this with just one person. It takes all of us. And any advice or tips I could give you if you're interested in being a nurse is do not do it for the money. You have to want to be a nurse to be a nurse. It is a very demanding job. It is hard, but it is also very rewarding. And it is one that is worth everything you give up for this. And it's something you can do. Never think you can't do it, because you can.